I recently received a picture from a client of mine that I was working with, and he was what we called a torsion. So I have a video I made last summer about what is a right torsion, and just briefly, it's a cranial pattern. And it's pretty obvious when someone is torsioned, because they will have a jaw or a chin that is shifted to the right. I don't want everyone looking in the mirror and seeing if their jaw is shifted to the right or whatever. It's a little more complicated than that, but that's one of the things you look for. And when that occurs, people will feel a crossbite. Now, if you look up crossbite on the internet, you might see different kind of pictures of what a crossbite might look like. Now, this will not really look like a major crossbite, because I'm going to show you the pictures. But you will see that this gentleman's teeth, the jaw is definitely shifted to the right, because the midline of the mouth, of the teeth, they're offset. So the teeth on the bottom are offset to the right compared to the teeth on the top. It's not major. And in fact, his teeth look relatively, perfect. You wouldn't even know unless you really looked closely. But I remember when I started working with him, I always ask people, how do you feel your teeth? How do you experience your teeth as you gently close your teeth together? And he said that he felt the right canines. So the canines are in front, okay? Not the incisors, the canines. They're the latter, they're right here, right? And that's exactly where my crossbite occurred, and that's what kicked out my canines and displaced them. I was a right torsion, so I understand this pretty well. Right torsions are problematic because it means your cranium has broken the rules. Now, I know some other schools of thought believe that torsions are, a right torsion is a normal pattern that hasn't broken rules. In PRI, it's pretty much taught that it has broken rules. So, and that's even hard to explain, because it just means that the arrangement of the cranium is in a way that shouldn't be permissible by how the body moves. It's no different than if your left hip has more range of motion, so a lot of people have what we call a pathologic left hip, meaning that their pelvis is rotated forward on the left side, and in that position, they should not have hip extension. So on the left side, the pelvis is rotated forward. When that pelvis is rotated forward, which is called the left AIC pattern, that person should not have hip extension, because the pelvis is not neutral. If they have full hip extension, meaning they can extend their hip, and if you don't know what hip extension is, it's going to be hard to visualize that. But if they have full hip extension, it means they're pathologic. They have stretched out ligaments in the front of the hip capsule. So their body has a range of motion that it shouldn't have. Well, the same thing can apply to the neck, and it can apply to the spine, the SI joints, shoulders. You can find it anywhere. When it happens in the cranium, not gonna lie, it's a little bit more difficult, because then it's completely autonomic. You get a lot of weird symptoms, constant tension throughout your body, and that's what this gentleman was struggling with. Sometimes he would do really well with PRI techniques. Other times it's like he couldn't get them to work at all. Some days he would feel great. Other days he would just feel horrible. And there was never any consistency to it. So I had a feeling it would be this right torsion experience. So I'm going to show you the picture now. So what you're going to see, the top picture is his midline without the splint. Okay, you can see that his bottom teeth are shifted to the right compared to the top teeth. The bottom picture is his midline with the splint. So the splint, he has it over his bottom teeth. It's over the bottom teeth. The splint is allowing him to retain neutrality. He's no longer using this crossbite sensation, this crossbite that his brain wants to go to. His brain was using that position of the jaw to the right as a way to stabilize a pathologic, hence unsteady, unstable situation. We don't want that to happen, because it keeps his neck tight. And in fact, I could get him neutral, and this was interesting. I could get him completely neutral But the moment, so he has full neck range of motion, full shoulder internal range of motion, full range of motion. But the moment I had him touch his right canines together again, he lost that range of motion and he could feel it. He could feel his neck turn on immediately. And at that point, I knew he needed to go with the splint because nothing was going to prevent him. His brain was going to keep going back to that crossbite to help stabilize a pathologic situation. Remember, pathology means unstable. He's using his teeth and jaw muscles and neck muscles. Well, I'll just say teeth and jaw musculature to help stabilize an unsteady cranium. Now, he had a pretty long history of physical and, you could probably say emotional trauma as well. So trauma leads to these types of situations. It can be physical, emotional, it can be a lot of different things. But because of that, his brain, just like me, his brain went to this, what we call stomatognathic system to help stabilize an unstable body. Now, again, it could be doing it to help stabilize a pathologic hip, an ankle that has been broken or sprained 3 or 4 times. Anything that's unstable, your brain's going to try to create stability somewhere else, and often enough, it happens through the teeth. So again, you see with the top picture, without the splint, his jaw has shifted to the right. With the splint, it keeps him neutral. The hope is that if he wears the splint at night and during activity, that he will be able to break his brain's habit of using the crossbite to stabilize his body, and he will then be able to stabilize his body through normal PRI techniques. That's the thing. We know he needs to stabilize his body through the appropriate muscles. We don't want him stabilizing his body through extension or compensation, which is kind of the same thing. Yeah, for now. Left to his own devices, if without that splint, his brain will go right back to his old habit, which is not his habit, but his brain's habit, which is stabilizing through the jaw. We don't want that to happen, so we have to keep the splint there to keep those teeth from touching. Otherwise, the moment he touches, his neck turns on and he loses range of motion and he goes back into extension. So that's the hope. I know he's feeling better. His neck is staying much more relaxed. He can feel, he likes to wear it. He said a little bit too much probably. But the hope is that eventually that bottom picture will occur when the teeth are aligned, which means his jaw is straight. Hopefully that picture will be able to be achieved without the splint in his mouth. If that doesn't happen and he takes the splint out and he keeps going back to the top picture, I don't know exactly how we're going to proceed after that. That's a little more complicated. And again, the other issue is that a lot of times people with occlusion issues, like I did, these types of crossbites, will often have a visual issue as well. So it can affect their vision. I can't even explain it, but it can. So often, sometimes people need some visual help. And that's why these things, and that's why I can't even really talk about this too well. And I know someone's gonna say, what kind of visual help? A different prescription. But the problem is not a lot of optometrists understand how to work with prescriptions. The idea that I was overusing my right eye for most of my life, that doesn't occur to most. They just correct your vision. I needed a special, and I still have it. My right eye is blurry, not blurry, but slightly blurry by not correcting the astigmatism. That forces my brain to keep using my left eye. Otherwise, my right eye has a tendency to take over. So because of a pattern, that's the thing. The pattern changes everything. We have patterns of visual perception. How our brain uses our visual system can change when you're in a pattern, particularly a pathologic pattern like this right torsion. So I can't really go into vision because I don't even know that, I don't know all the ways that vision will change. Not clarity necessarily, but how your brain will start to use your vision to help stabilize your body. I don't even know all those ways. I took the seminar twice, but I don't work with optometrists all the time, and that's harder information for me to convey because I just simply don't know. But I know how it worked for me, is my right eye likes to, or my brain likes to go to my right eye in times of stress. It's no different than going to your stomatognathic system in times of stress. And then of course it pulls you back into a pattern. So to neutralize that, I have to keep my right eye slightly blurry through not correcting the astigmatism. So if I close my right eye, you know, this is really clear. If I close my left eye, I can still see, but I know it's slightly blurry compared to my left. So that keeps my left eye in the game, so to speak. So my brain can't over-rely on my right eye. And that's the type of stuff that can happen with torsions. And unfortunately, not a lot of people know how to deal with that. Even I don't, because I don't know what you can do with vision to change that. All I know is that when someone lies down on my table, they have range of motion or they don't have range of motion. So if they don't have range of motion, we have to figure out why they don't have that range of motion. If they have the splint and their jaw is straight and they still don't have range of motion, well, there's a distinct possibility there's a visual influence, and then you have to work with that. But that's really complicated, and it's not something I can really go over in this channel because I can't even explain it well enough. So just hope that was illustrated why splints are used and what the goal is with the splint, to keep the jaw neutral, to keep the neck neutral, so that you can go through a PRI program, restabilize your body with the proper muscles. Because if you keep going back to the crossbite, which your brain wants to do, because that's been the habit for so many years, if you keep going back to that crossbite, the neck will turn on and it'll pull you back into extension, and now you can't breathe with your diaphragms, you become ungrounded, and you just go right back into the pattern. So that's why the teeth are such a big deal for people who have a true occlusal issue like a crossbite. If you can't resolve that, they just get pulled back into extension because their neck gets overactive, and then it's that whole, you just get sucked back into that pattern. So hope that helped.